Good morning. This is Dr. Nandini from Department of Conservative Dentistry and Endodontics. So today I'm going to talk about gingival soft tissue management. So basically, you have to know about what is this, like what is the need that we have to manage the soft tissue. See, always whenever do you do a restoration or supposing if you're giving a crown, your gingiva will always not be in a proper position. Sometimes there might be overgrowth of gingiva or inflammation of gingiva. At times there will be severe bleeding of gingiva. So those conditions will make or will hamper your further treatment steps. For example, if you are trying to do a restoration and there is a severe bleeding, you might not get a proper visibility or access. You will not have a proper convenience to do the further procedure. Similarly, when you are doing a crown, and if there is a, if supposing there are some clinical conditions wherein you are supposed to give a subgingival finish line, in order to record that finish line and impression, you have to retract the gingiva laterally and apically, so that you are able to visualize that finish line and get that accuracy in the impressions. So to overcome these situations, there is something called as a gingival soft tissue management. This is a very important question for a final year point of view. It can be either asked as an essay or any particular method can be asked as a short note. So basically, it is broadly classified as six types: physical method, chemical method, physiochemical, rotary method, that is using the burrs, surgical method is nothing but using the blades, and electrocautery. So first coming to physical methods, there are different techniques of physical methods. I have just put four in this. So we know something called as a rubber dam. So in this rubber dam, we have some part called as a rubber dam clamps. So these clamps can be used to retract the gingiva. So retraction cords are nothing but the various materials are different classifications. Retraction cord alone can be asked as a short note. There are different ways by which you can classify the retraction cord, like plain, impregnated, twisted, braided, etc. And even depending upon the color coding, this is a very important classification that will be asked as in Viva, like 000000123, and this will be labeled by a different color, and this color is indicated for the usage in particular areas. So for example, some will be very thick and some will be very thin. So depending upon the thickness, you will be using it in a different area, like anterior, posteriors and all. So retraction cord is one type, and there are different instruments that are used to pack this retraction cord around the tooth. And we can also use copper bands, it's shown in the image, and impregnated cotton rolls. Sometimes cotton rolls can be impregnated with the zinc oxide eugenol. The concept is that all these are physical methods, that is they will physically exert pressure to retract the gingiva away from the tooth structure. Now coming to something called as a chemical method. So what they did was, in order to achieve hemostasis, like to arrest the bleeding, they used various chemicals. So first, they are broadly classified as vasoconstrictors, astringents, and tissue coagulants. So the most commonly used vasoconstrictor was 8% of epinephrine, but since epinephrine is a vasoconstrictor which has got a effect on heart, like for example, it will increase the heart rate and all. It was partially contraindicated in certain heart patients, but it's a very effective vasoconstrictor. And in this question, they will ask you about how much percentage. That is a very important viva. That is 8% of epinephrine. So to overcome this disadvantage, they introduced something called as the astringents and tissue coagulants. Examples of astringents are nothing but alum, aluminum chloride, that is 100%. They are otherwise called as a biologic fluid coagulants. And the next one is nothing but a tissue coagulant. Is nothing but they will go and coagulate the tissue and they will arrest the bleeding. Examples are aluminum sulfate, silver nitrate, and zinc oxides. So the concept is that this might cause some tissue hypoxia and necrosis. So the most commonly preferred is astringents. These are some chemical methods. So what they did was they combined the advantage of both physical and chemical method, and they gave something called as a physiochemical method. That is, they utilized retraction cords from physical methods and they used vasoconstrictors from the chemical method. What they used to do is that they used to dip this retraction cord in that vasoconstrictor agent, and then using the specific instruments like Fisher's cord packing instrument, for example, they will pack this retraction cord impregnated with this vasoconstrictors around the tooth. So by doing so, we'll get the numbness effect on the soft tissue. At the same time, it will go and cause the constriction of blood vessels there, and they will arrest the bleeding. Also, you are able to displace the gingiva and record the finish line. So it's the most commonly preferred technique, that is a physiochemical method extraction method. So apart from that, there are some other methods of gingival soft tissue management. Examples like surgical methods, wherein we use blades to cut the gingival tissue. Example, gingivectomy, gingivoplasty, and periodontal flap surgery. And there is something called as a rotary method, wherein you use your rotary burrs to cut the gingival tissue. It is called a gingitage. But the problem is that in the rotary method, you will not achieve hemostasis, and there will be extensive cutting of the soft tissue. You will not have a control over your treatment. Then came something called electrocautery, so recent advances, wherein you use a high frequency electric current is being delivered through various tips. These are the various tips that are being used in electrocautery. So in this method, you will achieve excellent hemostasis, and we have a controlled action. Cutting of the gingival tissue is the most preferred method of doing gingival soft tissue management. Then lastly, you should know about the recent advances. So apart from using all these methods, there are now the various soft tissue lasers like diode lasers, Nd:YAG lasers that are available. They have an excellent hemostasis effect. Patient will not feel that much of pain or severe bleeding will not be there. At the same time, you will be able to adequately cut the soft tissue. Then coming to expartial technique and magic form technique. Expartial technique is nothing but you use some alum, aluminum chloride, kaolin along with some impression materials like polysiloxane. So the concept is that the moment you apply these paste around the soft tissue, they will go and swell the gingiva tissue. So as a result of which the gingiva will get retracted from the tooth surface. This is one of the painless technique, and magic form technique is also similar to that. It's also an impression technique. Here they use something called as a comrie caps. This comrie caps will be placed over the tooth, and inside this comrie cap these magic form impression material will be injected. So as a result of which you will also get the retraction of the soft tissue, and you will be able to record the finished it properly. These are some advancements. These are less painful techniques. So whenever any question is asked about this soft tissue management, you make sure you cover all these headings mainly, and then a point, 2 or 3 points under each heading is very important.